Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Not all heart disease is obvious. We hear about athletes who otherwise appear healthy collapsing mid-court because of an undiscovered heart defect, or the young mother who dies suddenly due to an unknown genetic disorder that causes the electrical system of her heart to malfunction. Today we'll be talking about hidden heart disease and the hints you may be ignoring but shouldn't. Welcome to Healthy Living for Life, a show designed to help you do just that. I'm Lisa Sattler, your host. Stay tuned. Welcome back. My first guest today is Dr. Sharon Hecker with Rocky Mountain Heart and Lung in Kalispell. Welcome, Doctor.
Oh, thank you. It's a pleasure to be here.
Thank you. So let's start a little bit about talking about young, fit teens and adults. We sometimes hear about athletes suddenly dying from a heart abnormality. Can you talk a little bit about what might cause this?
Yeah, that's a very tragic problem. Whenever we hear about it, it shocks everyone. But fortunately, it's very rare. There are a few common causes. Half of it is due to a disease called hypertrophic cardiomyopathy. That's an abnormal thickness in the heart muscle, and it can lead to problems with the heart pumping blood out to the body when you're during exercise. And it can also lead to arrhythmias, where the heart starts to fibrillate and stop during exercise. Other conditions that can cause this are congenital abnormality of the electrical system. We call that long QT syndrome, or Brugada syndrome is another example of it. That can be picked up on an EKG, but it might manifest itself by a person suddenly passing out without any provocation, maybe even during exertion. And then lastly, another cause is coronary or cardiac anomalies that a person may have been born with, but that don't really show up until their teen or young adult years.
So I've heard stories of athletes who've potentially received a blow in the chest and had something happen with their heart. Can you explain a little bit about that?
Yeah, that's actually very interesting and very survivable if it's treated properly. So I really want to get that out to people, that you can do something about it. Most commonly, we've heard about like the line drive that gets the pitcher right in the chest. The ball hits the heart at a time in the electrical cycle where the heart is vulnerable, and it will just immediately start to fibrillate or stop pumping blood. So the heart stops and the young athlete will collapse. The good news is that if you can start CPR right away, or get one of the automatic external defibrillators to defibrillate the heart, the person can recover completely. And we have many examples of that. So if you happen to be at a game and see an athlete get hit in the chest and fall down, it's very important that you act quickly.
Thank you. That's very good information. So can you tell us a little bit about the difference between a heart attack and cardiac arrest for our viewers, please?
Yeah, that's very confusing to people, and understandably, right? You know, they sound like the same thing. So a heart attack is when there's an interruption of the blood supply to the heart muscle. The heart muscle at that point will start to die. People can have heart attacks and not even know it. So they will lose a small portion of their heart muscle and actually survive and go on to do other things. Sometimes, however, when a portion of the heart muscle dies, it again causes the electrical instability, which causes the heart to fibrillate and stop, which is called a cardiac arrest. So the heart can fibrillate and stop due to electrical problems and not due to a loss of blood supply, a heart attack. So you can have a cardiac arrest without a heart attack, and you can have a heart attack without a cardiac arrest, but sometimes the two go together. One is electrical, the cardiac arrest, and one is more of a plumbing issue, the heart attack.
Are there symptoms with cardiac arrest?
Usually not. That's kind of when you hear of people who just keel over and die suddenly. However, if you have episodes of lightheadedness, or sometimes palpitations, or if you've actually had a previous cardiac arrest, you'll be at higher risk to develop a cardiac arrest.
And anything else that might put somebody at risk for cardiac arrest, certain lifestyles or things like that. Could you maybe talk a little bit about that?
I love to talk about lifestyle.
Okay.
And the reason I love to talk about lifestyle is that even in the highest risk patients who have the genes, the cholesterol, the cigarette smoking to lead to a heart attack, everyone can cut their heart attack risk by more than half by lifestyle interventions. And when I say lifestyle interventions, I mean regular exercise, eating a diet that is rich in fruits and vegetables, and maintaining your ideal body weight. Smoking cessation is also really important.
That's great. So we just maybe have a couple of minutes left right now. Can you maybe let us know some of the hints that your body might be giving you that something is indicating a problem with your heart?
Yeah, I think the biggest thing to look for is an abrupt change in the way that you feel. So for example, if every day you go out to get the mail at the mailbox and you feel fine, and then one day you start developing shortness of breath long before you ordinarily would, or some chest discomfort, or a tight or heavy sensation in your chest, any type of change I think is really important to pay attention to. If suddenly you start developing palpitations or feeling a fluttering in your chest, an irregular heartbeat, or new lightheadedness or fatigue that you hadn't perceived before, it's very important to discuss that with your doctor or your healthcare provider.
Swelling in your limbs, is that a sign or symptom sometimes as well in your feet?
Swelling in your limbs definitely goes along with heart failure. However, lots of people will get swelling, the imprint of your sock, for example, left on your shin after a car trip, which ordinarily isn't a big problem. However, if you start getting increasing swelling that you've never had before, or it's really starting to trouble you, you need to discuss it with your physician.
Great, thank you. We're going to talk with Dr. Hecker a little bit more after the break. Please stay with us. Welcome back. I'm with Dr. Hecker, who is with us today to talk about hidden heart disease. So doctor, some people actually talk about hearing their heartbeat at night when they go to bed, and I've even had this happen to me and often wondered about that. So can you talk about this? Is this cause for concern at all?
Yeah, that's really an interesting thing. I actually would encourage people, if you hear your heartbeat, it's quite normal. And we all can do it at different times. And I think it's really good to feel connected to your heart in this way. It really can give you important information about your health. If you feel other things along with it, for example, if you're thirsty or lightheaded, it might be a sign that you're dehydrated. If it's going fast or irregular or in some way causes you to feel troubled, that might be an abnormality, and it would be definitely something to discuss with your healthcare provider. It might even tell you that you're having emotional stress, and maybe that's something you need to think about and check in with yourself to say, what does my life look like right now, and are there things I could do to make it better?
So that's a great point right there as well. So are there differences between that emotional stress, perhaps even a panic attack or anxiety, symptoms-wise, versus a heart condition or heart attack?
Yeah, that's a really good question. And the difference can be very hard to sort out even for healthcare professionals. So I would encourage anyone, if they have a new symptom that they haven't had before or something that's troubling to them, to discuss it with their provider. Sometimes panic attacks can precipitate heart attacks or arrhythmias, a fast heart rate, and vice versa. Sometimes a fast heart rate, it actually creates stress and adrenaline in your body, which can then precipitate a panic attack. So they can be difficult to sort out if you know you have panic attacks and this is just like your other panic attacks, you're probably just fine. On the other hand, if you know you have panic attacks and suddenly you feel differently, that's a time that you might want to seek some medical attention.
And we're talking, immediately, not necessarily wait till you can make an appointment with the physician.
Yeah, maybe go to the emergency department.
Okay. So here's a question for you. Have you ever had anyone report tooth pain as a symptom of a heart issue?
I definitely have, and that's another one that's tricky to sort out. I actually had a woman who got 2 teeth pulled, and it was her pain was coming from her heart. She ended up on a trial of antibiotics because the pain actually was in her tooth and in her throat. And they thought then she had pharyngitis, and it all turned out to be her heart. That being said, most of the time, tooth pain comes from your teeth. But if you have, again, a new symptom that's unusual or can't be explained, or if you have a toothache and you go to your dentist and he or she says they can't find anything, it's probably a good idea to see your doctor.
And your primary care doctor can evaluate you and then decide whether or not maybe you need to see a cardiac specialist. Is that correct?
Yeah, primary care doctors are wonderful with that sort of thing. They can figure out, does the patient need more evaluation or not?
Great. So a question on postmenopausal women, and I'd like to know from your opinion, are postmenopausal women at greater risk for heart disease, and if so, why is that?
Yeah, that's a really good question, and I think it concerns a lot of people, and it also has kind of given us some hints on how to approach heart disease in women. It turns out that women get heart disease about 10 years later than men, and the reasoning behind that is it seems to be tied to when women go through menopause. So then you would think, well, gosh, if menstruation or estrogen cycling is good for women to prevent heart disease, then maybe if we replace estrogen in women, it would prevent heart disease. Unfortunately, as much as that's been looked at, we have not found any conclusive evidence that estrogen is helpful or harmful in patients for the prevention of heart disease. So our recommendation is really to not recommend it in patients and really to have women discuss that with their doctors, because there might be other reasons they should have estrogen replacement, but it's not really recommended for the prevention of heart disease.
Okay. So let's talk about the differences between men and women in symptoms of heart attacks. So I hear there might be some differences in symptoms between men and women who might be experiencing a heart attack.
Yeah.
Can you talk about that a little bit?
Yeah, so women, part of I think the issue is cultural. Heart disease was originally described by men about men. And so our symptoms that we have come to regard as typical are really just part of how the disease was discovered and described. So our typical symptoms are chest heaviness, tightness that might radiate to your neck, shoulders, back, or abdomen. Women get those symptoms too, but women also might be more likely to have no chest discomfort but just shortness of breath, or maybe just nausea without the chest discomfort. Another symptom of heart disease that is common, or heart attack that's common in both men and women, is sweating. So women have a little bit different symptoms, but they're all part of the same kind of basket of symptoms that point people toward heart disease.
That's great, good information. We have about a minute left. Any other final closing thoughts that you might have for our viewers that would just help them be more informed and engaged as patients in terms of taking care of their heart and knowing what to look for?
Yeah. Well, one of the things that I think is the most important for everyone is to listen to your body, to really listen to it. Like, what does it need? Does it need exercise? Does it need healthy food? How is your weight? I cannot stress enough that most of the reduction that we see in heart disease is due to the prevention and the main risk factors, which is don't smoke, maintain your ideal body weight, exercise regularly. We recommend 150 minutes of aerobic exercise each week. Eat lots of vegetables and fruits. Try to limit your carbohydrates. Those kinds of things really will help people if they're serious about reducing their risk for heart disease.
Well, that is such great information, and I'm sure viewers will appreciate all of the tidbits you've shared with us today. So I thank you so much for making it here. We appreciate it very much.
Well, thank you. It was a pleasure.
Thank you so much. Well, on behalf of our viewers, I want to thank Dr. Hecker again for this great information. Up next, we'll talk about what you can do to help prevent heart disease. Stay tuned. My next guest is Britt Ballinger. Britt is an associate member of the American College of Cardiology. She's also certified by the American Academy of Nurse Practitioners. She's worked for the International Heart Institute and for Medtronic Incorporated as a clinical specialist in cardiac rhythm management. She is now with St. Peter's Medical Group in Helena. Hi, Britt. Welcome.
Hi. Thanks for having me.
Thanks for being here. So let's start out a little bit talking about, we talked a little bit about hidden hints today and what your heart may be telling you to indicate that you have potential problems. But what are some other risk factors? I mean, specifically, can you talk about family history and go into that a little bit about a potential for indicating you might have a heart, issues with your heart?
Family history is unfortunately the one thing that we can't do anything about, so we can't pick our parents. But
Yes.
What that means is if you have a first-degree relative, a mother, father, sister, or brother who has had heart disease, for women under the age of 65 and for men under the age of 55, that means that your family history is positive for premature coronary disease, and that is a risk factor for you. So then you just need to be more aware and proactive.
So that's really something you need to make sure you share with your provider when you go to have a medical checkup. That's obviously very valuable.
Right, yes.
So what are some other indicators that heart disease might be in your future other than family history, which we don't have any control over?
Well, there's a lot of things that we can actually do things about. Number one thing is smoking. If you smoke, quit. You can't. Smoking raises your risk for every disease, especially heart disease and stroke. My mom was a smoker and she died at age 56. I think if she didn't smoke, she would still be here. So smoking is number one. The other thing you can do is exercise. I'd say if you took two identical twins and one did everything wrong, did smoking, diabetes, everything wrong, and the other one walked their dog and did everything wrong, the one who walked their dog will live longer. So exercise is very important, and it's recommended that you get, just for general health, that people get 30 minutes of regular physical activity most days of the week. And that doesn't mean that you need to go out there and do a marathon. Walking for 30 minutes is physical activity. I ask a lot of patients if they exercise and they say, well, I'm really busy at my job. That doesn't count. It has to be 30 minutes consecutively. You can divide it up. It can be 15 minutes in the morning and 15 minutes at night, but 30 minutes of sustained physical activity where your heart rate gets up a little bit is what's recommended. The other thing that I run into with patients a lot is they find a lot of excuses that they can't exercise. And if you have, some people have bad knees. If you have bad knees, you need to find a way to exercise. If you need a knee replacement, get the knee replacement. If you can't walk, do a water aerobics class. So you'll live longer if you keep moving. So, and on that vein, being overweight is also a big risk for cardiovascular disease. So diet is important there. The most successful diet program is Weight Watchers, and studies have shown that any diet program where people record what they eat is the most successful. So they have a lot of online diet trackers out there. I have one on my smartphone. They have a huge database of food. It records calories, carbs, sodium, and you can scan them with your phone. They're really easy to use, and it keeps you accountable. If you have diabetes, just make sure you work with your doctor to keep it in good control. If you have diabetes and it's out of control, then your risk for cardiovascular disease is way higher. So it's really important for diabetics to keep their sugars in control. Same with high blood pressure. And these two things also relate to family history. You can acquire diabetes with weight, but a lot of times it's genetic, and same with blood pressure. Blood pressure does go up as we age, but since we live so long now, we still don't really accept those high numbers so that people can feel good longer. So it's important for people to work with their doctor to keep their blood pressure in good control.
Great. Stress, how about that?
Stress management is huge. I mean, there's a lot of studies that show people, those type A people are more prone to cardiovascular disease. So techniques, they're doing a lot of studies with meditation to improve cardiovascular outcomes, yoga, exercise, laughter, taking a hot bath, just if you have a situation in your life that's causing you stress, find ways to mitigate it.
Thank you. You talked a little bit about your mom, and she potentially had a silent heart attack. Can you elaborate a little bit on what that means?
So what she died of was really a stroke, but when she came to the ER and they were checking her out for her stroke, they did an EKG, and it showed evidence that she may have had a heart attack at some point, probably way prior to the stroke. So a silent heart attack is one that occurs without you knowing about it, but then they can find evidence on an EKG or echocardiogram. In her case, her stroke was pretty severe. She lost the use of the left side of her body and the right side of her brain. So kind of since the heart attack had already happened, the stroke was more of the focus. So there was nothing to be done about it in her case.
Hey, we have about a minute left. Can you think of common complaints or symptoms that might make you suspicious of heart disease in 30 seconds or so?
Oh, I'll try. When someone says, it's not really pain, it's pressure, I get suspicious. Or any symptoms that people have waist up that go away with exercise make me a little suspicious. Shortness of breath is a big one, chest pressure is a big one, fatigue is a big one, palpitations can indicate a problem. It's just a good idea to check in with your doctor if you're having that stuff, especially if it goes with exertion.
Great. Well, I want to thank you for all that great information. I'm sure our viewers will appreciate that. So thanks for being here.
Yeah, thanks for having me.
You bet. Looks like we're about out of time. So I want to thank again my guests and to remind you at home to stay well, stay fit, and stay healthy with Healthy Living for Life. We'll see you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.